Good afternoon. I am Dr. Yogesh Batra. I am a senior consultant in gastroenterology at Indraprastha Hospital, Delhi. Now, liver disease can actually be divided into acute diseases and chronic diseases. When I talk about acute diseases, it means that these are diseases which have come suddenly, they are fulminant, and they can result in liver failure. Chronic diseases are diseases which have been there for a long period of time and they lead to liver damage gradually. So these are the causes of liver disease. Liver disease can be caused by alcohol, viral hepatitis, needs guidance on stomach ulcers, do's and don'ts. Okay. So stomach ulcers today are mostly found in smokers. So first and foremost, quit smoking and quit alcohol. Get an endoscopy done and find out the type of ulcers. If you're talking about gastric ulcers, then they need to be biopsied to rule out malignancy. If you're talking about duodenal ulcers, then you need to document them, take treatment with effective drugs which are available now, known as proton pump inhibitors. In addition, do not drink too much of tea, do not drink coffee, and do not have too much of stress in life. And what is the precaution in terms of lifestyle changes and diet? We have to take, as my SGPT ALT is 67.7, which is as per the reports on the higher side. Yes, that is true. As I was telling you that fatty liver is one of the commonest reasons for liver disease now. So SGOT-PT elevated above the normal. Any value above the normal means fatty liver, which means that this 1.5 kgs of liver is now getting inflamed. So these values have to be brought down to normal. So if you are overweight, you need to reduce weight. That is actually the most specific thing to do for fatty liver. You need to exercise and you need to eat less. In terms of eating less, there has to be a reduction in carbohydrates, which means that you have to reduce roti and chawal. You have to cut down on sugars completely. You can eat salads, you can eat fruits, and you can eat protein. Exercise means exercise has three components: flexibility, which is stretching and yoga, strength or weight training, which is by weights, and stamina, which is jogging, running, cycling, cross training. All three components have to be done. Now, what is gastroesophageal reflux disease? So gastroesophageal reflux disease means that the stomach has a lot of acid which is forming, which is formed naturally because it is something which is needed for digestion of proteins. The esophagus, on the other hand, is designed not to have acid in it because there is no digestion taking place in the esophagus. So if the stomach acid comes into the esophagus, it causes burning and it can cause pain. This is gastroesophageal reflux disease. Another reason for this is a weak. So this was about liver disease. As you must have seen that today we are dealing with the epidemic of fat, we are dealing with the epidemic of alcohol, and if we have to control liver disease, we have to become fit. We should not be obese, we should not be drinking, we should not be eating too much, and we should be eating the right kind of foods. We should be avoiding non-prescription drugs, and we should not be taking drugs indiscriminately. Another important thing to prevent liver disease is that we should be vaccinated against hepatitis B. We should take care of all these things, and if we suspect liver disease, if we have jaundice, or if we have any of the symptoms which I talked about, we should go to the doctor at the earliest. Thank you so much.